is a complicated topic. It's necessary, and it's developed in our earliest relationships. Unconsciously, we are forming links through relationships with people. As a result, it's intensely personal, full of ups and downs. While our initial relationships are with people, eventually we're building relationships with establishments, schools, committees, governments, companies, institutions. So for this particular issue, I'm going to break it up a little bit because it's a little complicated. There's trusting and being trusted. And then I'm going to walk you through some of my earlier experiences as I navigated through these two concepts. So I'm a middle child. My older brother, I trusted for a good adventure. And you can see a little bit of the copycat behavior in there. I'm hoping that you can also see that we had loving parents that we trusted for everything else. And some of that's evidenced in the clothes and in a little bit of the hair. You see, in childhood, at about the time when I was questioning why a man in a large man in a red suit was hopping in and out of chimneys on the same day every year, my family had planned a trip to India. At that time, a bunch of other early understandings came into question. So, within the first few days of stepping into Mumbai, first of all, we flew over and I was meeting my extended family for the first time. Within the first few days, I was intrigued because there was one variable that was held constant: my ethnicity. Everyone had black hair and brown eyes. And as a result, all the other variables stood much brighter for me to see. There were kids who were dressed for school, and then there were kids who didn't go to school. There were kids who had parents, and there were kids who didn't have parents. There were kids who had food, and kids who didn't have food. And then there were kids that were healthy, and kids that were visibly ill. It seemed like many of the systems that I thought that existed were not apparent in this system. Poor health stood out. Similar to other youth then and now, I too felt like nutrition and health were issues that needed to be solved. And being a physician implied the right role for the task. So step forward many years into the future. There was high school and internships, externships, some research, and there was a BS degree, and eventually there was medical school. And in medical school, I planned, saved, and strategically placed an internship into my last year of medical school. That was a trip back to India. I was going to work in a village called Jagadhya in the state of Gujarat, and I was ready to work really hard. But here's where it gets complicated. Within the first few days of my internship, I met with the physician in charge. His name was Dr. Samir Shah. And while I anticipated a warm welcome for an extra pair of volunteer hands, what really followed came in sharp contrast. It was a blast of questions. What was I doing here? What was I hoping to accomplish? What was my goal? What I heard was I was an outsider. More learning, and unknowingly, a more important lesson followed. So within a few days thereafter, I was invited to Dr. Samir and Sangeeta Shah's home for dinner. It was a simple, small bungalow in the middle of the village. No name tags, no white coats. Dr. Shaw was rolling rotis in the back with hired help and some of the hospital staff. I was invited to participate in the making of dinner. And eventually, all of us sat in the middle room on the mud floor, eating from clay plates with our hands, and it was shared conversation, including all. The physicians spoke about the medical details in the hospital, careful to include all the details of care, of family nutrition, and total well-being of the patient. And the physicians leveraged the input of all in that room, the expertise of those people. I could see clearly that there was built trust in that room, and eventually in the days that followed, I could feel the trust within the community. The next weeks for me were deliberate actions in understanding how to build trust. And I would say, really, I was pretty lucky to be able to not only witness, but feel the value of this kind of trust. This kind of trust is important in medicine for sure. Science and didactic learning really provide a framework and a structure for medicine, but really it's useless if a patient doesn't feel the care of the person or the system that they are receiving care from. So let's step forward into the pandemic, 2019 pandemic. In 2021, we saw personal contact decrease and we saw telecommunication increase. We saw face masks and shields replace smiles, hugs, and handshakes, thereby changing the existing relationships. And in the clinics, the physicians had to actively, creatively try to figure out ways to maintain the trust as they were treating disease. In 2021, vaccines became available. And at that time, we saw an irregular uptake of vaccinations across the generations. However, when we moved further in time and broke up the data a bit differently, by ethnicity, race, and culture, we saw a different kind of breakdown. We saw more pockets where vaccines were not distributed equally. And even more alarming, when we looked at intensive care admission rates as well as death rates, we saw higher rates among Blacks and Hispanics across all generations. And this cannot be explained by genetics or underlying disease. Clearly, the medical system in America needs to do more to serve the communities that they're responsible for. The great part about information is this same kind of information allows for people to do more. It empowers them to do more. Last summer, we saw thousands of clinicians looking at that kind of data, angered and demanding reforms, changes for underlying systemic biases. As a result, medical societies and communities, as well as quality institutions, national quality institutions, stepped up to the plate by providing intensive learning platforms, seminars, and quality initiatives to not only measure and monitor for change into the future. Better is possible. Let's take a minute to talk about industries. So I'm going to pivot a bit. Historically, we know that companies have the ability to build or break community trust. Historically, we've seen companies strategically take well-educated people and have them work on scientific developments and advancements of technology that ultimately leads to the destruction of human lives. The tobacco industry. Tobacco giants in the 1980s conducted internal confidential research. Their research was to capitalize on the addiction craving benefits of tobacco alkaloids on the brain. We know that smoking is a leading cause of cardiovascular death, respiratory failure, and numerous preventable cancers. We know even today that smoking-related deaths are more than murder, suicide, alcohol, drugs, and car accidents all combined in a given year. And over the past 15 years, we've seen the opioid crisis ignite. This is really the corruption of a single pharmaceutical company, Purdue Pharma, backed by the Sackler family. Billions of dollars are being earned while families and communities are being destroyed. We have over 500,000 people who have died related to opioid use. And all of this while fragmenting the trust in the pharmaceutical company as well as the medical community. And then there's the vaping industry. They are positioning themselves carefully among the unassuming youth, where addiction potential, long-lasting addiction potential, is high. And more recently, they are working on a synthetic nicotine to bypass FDA policy safeguards. So, what would it look like if a company was asked or required to hold community trust at the same level as profit margins? So, what do we know so far about trust? I'm going to try and somewhat summarize this. So, at the individual level, we know that honesty, integrity, accountability, timeliness, all of that still matters. I would make the case that when that foundation is strong, hair color and eye color really don't matter much. But the next steps of deliberately earning trust require more specific actions. So listening carefully, with tempered judgment, maintaining compassion, as this allows the mind to see all aspects of complex issues more clearly. It's a given. We will not be able to see every situation perfectly clear the first time. And if we have critics, and we will have critics, this is an opportunity for us to hear uncensored, unfiltered information for our own insincere behavior. I would make a case to listen carefully and use wisely. We are in an era where data and information will help us distinguish the difference between belief and truth. We have tools through the educational system, school, that have allowed us to understand these complex issues better. We then have the choice to deliberately focus our efforts on building our communities or tearing them apart. Now, I would make the case that trust is an untapped energy source. Just imagine the magnified strength of our community built on a strong foundation of trust. Thank you.